Ever wonder how people handled, say, a bad cut thousands of years ago, before all the modern stuff we have?
It's a fascinating question, right? Because you think, well, they didn't have antibiotics or sterile operating rooms.
Exactly. So today on the deep dive, we're digging into ancient wound care. We're looking at some really interesting details from sources like ancient wound care methods.
And our goal, really, is to see just how ingenious people were back then.
Yeah, to uncover some of those surprisingly effective ways they treated wounds, showing off that, resourcefulness.
It's pretty remarkable. They didn't have our scientific framework, but they observed things incredibly closely. Necessity and observation, really.
Okay, so let's jump in. Ancient Egypt. We know honey was important, but they put it on wounds.
They did. It seems they used it as a sealant, almost like a natural bandage, and it has antibacterial properties.
So they must have noticed it just worked better.
Probably. Wounds treated with it likely got infected less often. The low moisture and sugars in honey make it hard for bacteria to thrive. They wouldn't know why, but they'd see the result.
Right. And get this, moldy bread. That sounds kind of gross.
It does, but think about it. Some molds produce penicillin.
Ah, so like a primitive antibiotic.
Exactly. They were observing that applying certain molds could fight off infections. Purely empirical, but effective sometimes.
Okay, this next one is a bit wild. Maggots. On purpose.
Yes. Intentional use of maggots, or larvae, to clean wounds.
That sounds intense. How did that work?
Well, maggots tend to eat only the dead necrotic tissue. So they would essentially clean the wound, preventing the spread of infection and helping healthy tissue grow.
And that's something still used occasionally today, right? Maggot therapy.
It is, in specific situations. Biosurgery, they call it. So the Egyptians were onto something there.
Incredible. Okay, moving across to Mesopotamia, their approach seems a bit different, mixing practical stuff with more spiritual elements.
Yes, there's definitely a blend. And interestingly, they even had laws, like the Code of Hammurabi, that regulated things like surgery fees.
Fees. So medicine was already a profession.
It suggests a level of established practice, certainly.
Yeah.
And they use specific things, myrrh, for instance.
Myrrh, like in the Christmas story.
The very same.
Yeah.
We now know it has anti-inflammatory properties. They also use sesame oil, likely for burns, and copper salts.
Copper for cleaning.
Essentially, yeah. Copper has antimicrobial properties, so it would help sterilize things.
But wow, the consequences if things went wrong.
Oh, absolutely. The penalties for failed surgeries could be severe, even losing one's hands, according to Hammurabi's code.
Talk about high stakes.
It really underscores how important healing was, but also the risks involved back then.
Okay, now the Roman military. These seem like the sort of elite doctors of the ancient world, dealing with battlefield trauma all the time.
Definitely advanced for their era. Constant warfare meant constant practice with severe injuries. They developed some key techniques.
Like what?
Things like using ligatures to tie off blood vessels and stop bleeding. That's huge.
Yeah, that's fundamental.
And they used bandages soaked in wine.
Wine for cleaning.
For disinfection, yeah. The alcohol would have helped clean the wound. They also practiced early forms of cauterization, sealing wounds with heat.
Ouch. But effective, I guess. And they knew about silver, too.
They seem to observe that silver had some kind of preserving or cleaning effect, like water stored in silver vessels staying purer.
Long before anyone knew about microbes or ions.
Exactly. Pure observation leading to a practical application. They didn't know why silver worked, just that it seemed to help.
It's just amazing. And then you hear about other places, too, like in the Indus Valley using turmeric paste.
Right, which we know today contains curcumin, which has antiseptic and anti-inflammatory effects.
And in the Amazon, healers using bullet ants as stitches. That sounds incredibly painful.
It certainly does, but the ants have powerful mandibles. The healer would get the ant to bite across the wound edges, then break off the body, leaving the head as a sort of natural clamp or suture.
Wow. Resourceful, but wow. And the Greeks using spiderwebs?
Yeah, apparently to help stop bleeding. Spider silk contains vitamin K and has properties that can help blood clot.
So much of this sounds strange, but you're saying modern science actually backs some of it up?
In many cases, yes.
Yeah.
It confirms the effectiveness, even if the original understanding was based purely on observation and trial and error.
So when we look back at all this, what's the main thing to take away?
I think it's the sheer ingenuity, the human capacity to solve problems even without the knowledge we have now.
Right. People everywhere figuring out how to heal using what was around them.
Exactly. Observing nature, experimenting. It really makes you appreciate modern medicine, of course.
Oh, absolutely.
But it also gives you respect for these ancient foundations. They weren't just myths. They're practical solutions developed over centuries.
It definitely shows how clever people have always been, finding ways to survive and heal.
These weren't just random guesses. They laid the groundwork in many ways for medicine today.
Thinking about all this, it kind of makes you wonder, doesn't it? What other primitive or old-fashioned practices might actually hold some surprising scientific value we just haven't fully recognized yet?
That's a great question to ponder. There might be more ancient wisdom waiting to be rediscovered.
Definitely something to think about. Well, thanks for taking this deep dive with us today.